Good evening, and it's great to have you with us here on this Tuesday night. We have a lot to get to tonight. President Trump and the election and the Attorney General Bill Barr. The AG today declaring there was no evidence of widespread voting fraud. But we're going to begin tonight with news coming in right now from the CDC. The vote this evening by a committee of experts recommending who should get the vaccine first. And tonight, even with the first batch of Pfizer vaccine here in the U.S. already, Pfizer is waiting for emergency use authorization. The head of the FDA was at the White House today and was asked why no approval yet. When should Americans expect it? Tonight, hospitalizations rising in 43 states, Washington, D.C., and Puerto Rico. The number of patients fighting COVID in the hospital, more than 96,000. That's another record. And tonight in New York City, hospitalizations back where they were in June, and they are asking retired nurses and doctors to be prepared to help. In fact, the number of hospitalizations in New York City more than doubling in just the last 3 weeks. The governor very alarmed with what they're seeing here. But we're going to begin here tonight with that vote a short time ago at the CDC, the recommendation on the vaccines and who should get them first. ABC's Steve Osunsami at the CDC, leading us off in Atlanta.
American health officials tonight are calling it Phase 1A. After an emergency meeting in Atlanta, they've decided to encourage the nation's governors to give the first available doses of the coronavirus vaccine to certain seniors and healthcare workers.
In discussions with the jurisdictions, most of them believe that they can vaccinate all of their healthcare workers within 3 weeks.
The government is expecting about 40 million doses from 2 drug makers in the next few weeks, enough to immunize 20 million Americans. The experts took a vote and said that the best use of these first shipments is to first cover some of the heroes, the nation's 21 million healthcare workers, including those who work in hospitals, pharmacies, and clinics. And they say we also need to try and first immunize the most at risk, the nation's 3 million seniors and the people who care for them, who live in nursing homes and assisted living. 40% of all coronavirus deaths in this country happened in these long-term care facilities.
If we can pull together as a country and in the next 60 days vaccinate all of these residents, we can cut the death rate almost in half.
The FDA still hasn't yet approved any of the vaccines for emergency use, and the head of the agency got an earful from the White House today because of this. He explains that the Pfizer vaccine could get a green light after a meeting next week.
No one at FDA is sitting on his hands or her hands. Everybody's working really hard to look at these applications and get this done.
Once the FDA says yes, the states have to make tough decisions. California, for example, will get about 327,000 doses in the next few weeks, but there are more than 2.4 million Californians who work in healthcare. In the city of Chicago, about 25,000 doses are already dedicated.
We have plans that will start with all 37 Chicago hospitals, and we have plans for all 128 long-term care facilities.
Next in line, as more vaccine becomes available, about 87 million essential U.S. workers, like police officers, teachers, and grocery store workers.
This is going to be a Herculean effort. Let's get right to Steve Osunsami with us live from the CDC because there's news on another front tonight. I know the CDC out with new guidance tonight, planning to shorten the recommended quarantine time for people who believe they've been exposed to others with the virus.
That's right, David. The CDC briefed the White House on this today, so this is becoming real. Currently, if you are exposed to someone who is infected with the coronavirus, you are expected to quarantine for 14 days. What they're changing it to is this. If you can get a negative test, that quarantine would become 7 days. Without one, 10 days. The idea behind this is that 14 days is too restrictive for most Americans and that 7 or 10 days is much more realistic. David?
All right, Steve Osunsami leading us off tonight. Steve, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.